Good morning, everyone. Thank you for joining the Health Industry Leadership Winter Quarterly Meeting. We are very excited to have special guests with us and updates and presenters on a fantastic topic I think we can all relate to. So we're very excited for you to be here. If you haven't done so, please feel free to introduce yourself into the group chat, include your name, your organization, and your role. And then in addition, if you see anybody else here who you'd like to reach out to, please feel free to send a private message to them, connect, exchange contact information, and set up a meeting afterwards. We do facilitate and support that here at the HILT as well. Very excited for all the attendance that we have today. And to get us started and kick us off, we're going to start with Ryan Davis. He's going to go ahead and kick us off in the meeting. Ryan, off to you.
Great. Thanks, James. We have a packed agenda today, and I am pinch hitting for one of our HILT captains who had, unfortunately, a veterinary emergency. Stacy was supposed to be joining us today, but we know that sometimes life gets in the way, and we wish her and her furry friends the best. So just as a quick reminder about HILT's purpose and vision, and we're about to enter first. James, are we 6 this year or 5? I can't remember. It's 6 years, isn't it?
Oh, wow. We are coming up on 6 real quick. Yes.
Man, we are so old that we have to like go to our second hand to count our age here. But HILT is a network. So while James, I, and our partners at the Workforce Development Council, convene HILT, this is all about, this is all about you all coming together to be able to to share information, be able to take action together. And the date's right there. So here in May, at our next meeting, we will be celebrating our 6th birthday, so right into first grade. One of the things I think that's really important about HILT is that we center equity in all the work that we do. And I think our guest speaker today embodies that value and is going to help advance our knowledge on really important topics. Next slide, please, James. So our goal today, we've got a couple things. So we mentioned we have a guest speaker coming in, and this is going to be a fantastic, a lot of information, and then we'll have the opportunity for some discussion and question afterwards. We're also going to hear from our 2 vibrant committees. We have a huge event coming up in March, our Sound Careers in Healthcare event that is sold out already, but we are in need for some volunteers and some other ways to be able to plug in. And then at the end, we do have a couple healthcare programs that we do want to spotlight. So we're going to do a little bit of speed dating and allow them to be able to share out a little bit about those programs that are out in our community that are bringing vibrant, diverse, and skilled workers into our healthcare talent pipeline. So a packed agenda today. So without further ado, I would like to introduce our guest speaker. So Kelly Jenkins-Pulse is joining us from the Department of Labor, and she has a long and distinguished career, particularly advocating in women's issues. She is a graduate of George Washington University and has previously worked on the National Committee for Pay Equity. But again, her current role is that she is the regional administrator for the Western Region of Department of Labor Women's Bureau. So Kelly, without further ado, I'm going to turn the microphone over to you and let you share the amazing presentation that you have prepared for us today.
Thank you so much, Ryan, and thank you, James, for inviting me. And it's wonderful to be here with all of you today. I have a presentation today that I hope you will, pardon the pun, but you will leap with me into this discussion of how we expand retention for healthcare workers by focusing on midlife and older women in the workplace, and particularly applying a gender lens to workplace violence issues. So if we go to the next slide, I'll give you a little bit of background. We can go to the next one. We'll give you a little bit of background about the Women's Bureau. We are a federal agency within the Department of Labor, and we have a very simple focus. We study where women are in the workplace, and we collect research and data and do policy analysis, and we advocate for programs and policies that improve women's jobs, their wages, and their working conditions. Next slide, please. We are a very old agency. I often find that people haven't heard about the Women's Bureau, but they often know us for our work, if not by our name. We were behind the scenes during the creation of the Fair Labor Standards Act. Originally, some of the work that the Women's Bureau was promoting for women got extended to everyone in the workplace under the Fair Labor Standards Act. And of course, you all know about the Equal Pay Act and Pregnancy Discrimination Act and the Family Medical Leave Act. The Women's Bureau research and advocacy on those issues helps bring them into fruition. Next slide, please. The way that we do our work is through a national office and regional offices. Our national office primarily does the research, policy analysis, offers grants to extend the reach of our work. And here in the regions, we do a lot of education outreach, such as the presentation I'm doing today. We do not have any enforcement or regulatory responsibilities, but we work very closely with a lot of those agencies that do enforce the law, often because people have a workplace problem and they don't know where to turn, and they often come to the Women's Bureau first. So we have to have a pretty good understanding of where to refer people when they do have workplace challenges. Next slide, please. Just wanted to give you a little bit of explanation of the reach of our regional offices. So I'm in the orange section of the country, our Western region office, which includes all of the Pacific Northwest states, all of the Southern Pacific Northwest states, and even Alaska and Hawaii. So we have a small staff, only 4 of us to serve this enormous region, which is why you may not, hear about us so often, because we're spread very, very thin, but also very, very focused on connecting with organizations that are aligned with the work that we're trying to do, which is why I'm so, thrilled to be talking to you today, because I feel like the work that you do is really important in helping to apply some of the policy and the research that the Women's Bureau has to offer. Next slide, please. We have 3 main priorities. There is a 4th one, but that's more of an internal one to be a model workplace. But we have 3 main priorities that are externally focused. That is to eliminate the gender pay gap. And we do that by focusing on the higher paying jobs where women are frequently excluded, and then looking at the jobs where women are currently working and trying to raise pay and opportunity for them to grow and advance in those careers. Our second main priority is to reduce the caregiving penalties that hold women and low-paid workers back. And we often find that some of the family care responsibilities get in the way of women's job opportunities. So if we can advance workplace support, such as childcare, paid leave, workplace flexibility, we can reduce those caregiving burdens and help more women be successful at work. And then the last priority is to eliminate gender-based violence, harassment, and discrimination in the world of work. And I'm going to talk a lot more about that later today. Next slide, please. So first priority, eliminating the persistent gender wage gap. We have a grant program called Women in Apprenticeship and Non-Traditional Occupations that really helps us extend this work of getting women into jobs like technology, trades, manufacturing, all the green jobs. We work pretty closely, for instance, for the city of Tempe, who's currently trying to expand a green jobs initiative. One of our WANTA grantees is called ANEW. They're based in Tequila, and they do a lot of work providing training for women to enter into those non-traditional jobs. And then for the focus of women that are in more of the traditional jobs, education, obviously healthcare, social work, we work really closely to expand the Department of Labor's Good Jobs initiative. And on the next slide, I can tell you a little bit more about that. So what is a good job? The Department of Labor and Department of Commerce have worked really closely to identify 8 principles that we feel comprise a good job. and we work to help unions, employers, researchers, state and local governments, other federal agencies understand how these 8 principles really can impact the quality of work. And we, focus on each of these. For the Women's Bureau, in addition to talking about these main principles, we also try to add in how a look at gender makes a difference. And also today, what I want to do is focus on how the healthcare industry is really perfectly positioned to be a pioneer and to focus on a couple of these where you can really have some impact. And that's going to be looking closely at the DEIA, diversity, equity, inclusion, and accessibility, looking at benefits, looking at job security and pay. Next slide, please. So let's start with DEIA. With a workforce that is 75% female, it's kind of obvious for the healthcare industry to take a look at this and to see how a focus on DEIA could make a difference. In particular, midlife and older women. So we talk about DEIA, it can be everything, but we don't often think about midlife and older women as a part of DEIA. But one reason to really focus on that is because women's labor force participation rate has increased significantly since the 1940s, and we have more women that are working longer. 1 in 10 U.S. workers are a woman who's 55 and older. And of course, the share of healthcare workers, particularly a few certain occupations, the number of older women is just stunning. And so the retention of women is really an important business strategy. Some of the occupations listed here, obviously home health care aides, personal care aides, registered nurses. The other reason to focus on this is because of women's work patterns being a little bit different than men. They have taken more time out of the workforce, and they have scaled back their working hours. They have faced a lot of barriers such as discrimination and hostility to work. It used to be legal to pay women less, particularly in the jobs where there were few men to compare them to. Those occupations have struggled with lower pay. And so over a lifetime, many older women simply aren't prepared to retire, and they really depend on their employment to make ends meet even when they're well beyond retirement age. Next slide, please. So this is an issue that is a new area of programming for the Women's Bureau. We're really starting to look at how a focus on menstruation and menopause at work can make a difference in retention of older women workers. We'll start with the obvious. Nearly half the labor force is going to experience menstruation or menopause. And in a workforce that is 75% female, that's another huge reason to take a second look at this issue. I think it's become more common for employers to think of things like childbirth or lactation at work, the need for paid leave. But we don't often think about menstruation and menopause. They've often been thought of as personal issues that we just don't describe at work. Women themselves are not encouraged to talk about having a period, especially not at work. It's something that people feel like is a private matter, and they really shouldn't discuss it. But the reason to think about it for a workplace issue is that there are times that having a period or going through menopause can be very disruptive at work. Some of the typical symptoms include things like cramping, anxiety, headaches, need to have more frequent access to a restroom. And then as women become older, in their 40s, they start to transition into perimenopause. And every woman's experience is going to be individual. but there are a lot of common symptoms that some people experience in more extreme fashion. Everything from just having an unpredictable cycle to having disability sleeping. And of course, if you're not sleeping well, that's going to make an impact at work. Being uncomfortable with hot flashes, headaches, increased anxiety, all of these things can make it difficult for some women to feel confident at work. Earlier this year, the Women's Bureau did a webinar series where we brought in some doctors, we brought in some researchers, we brought in some organizations that are beginning to take a look at addressing menstruation and menopause at work. And I will send to James a resource guide that we created after this webinar. It actually has a link to the recording if you want to listen to it. But it has a lot of resources about how employers are beginning to address these issues and why it makes sense to do so. We have found that the UK in particular is way ahead on thinking about these issues as a workplace strategy, in part because they have framed them as a recognition of older women as their essential workforce and wanting to reduce any potential workforce shortages that might happen if women start to retire at an earlier rate, and how that can have an impact on the workforce. But I want to take just a little bit of minute to talk about, some of the policies and practices that could make a difference on this issue. The first is just going to be schedule flexibility, being able to accommodate people that need a flexible working environment or a shift modification. A second one is access to temperature controls or ventilation, things like fans or windows that can be opened. A huge one that we heard a lot about in our webinar was, things like uniforms and having to wear white. A lot of healthcare workers, routinely see them in white, but that can be a really difficult color to wear if you're experiencing a really heavy period or an unpredictable cycle. So if you are being, confined to just wearing light clothing or white clothes and not having the ability to change your clothes frequently if you need to, that can be, a really, really difficult thing. It can cause a lot of anxiety for people, a lot of embarrassment. So these policies are ways that help bring dignity back into the workforce and help women feel like, yeah, of course, everyone has, everyone who has a period is going to experience this from time to time. It's no big deal. We're going to provide you the support you need to accommodate you. Other things are just, simple things like having access to period supplies in restrooms and, being able to talk about it openly, being able to take leave if, you're just having a really, really bad day and you just need, to have a day off from work. These are kind of simple accommodations that can make a huge difference in people's comfort level. And also training for managers. It's not easy for workers to bring these issues up to their managers, but if their managers have had training and can signal to their workers that I'm open to talking about these issues. If you're struggling, I want to hear about it. I want to support you. These are kind of the policies that we're starting to hear more and more employers think about and to actually explore how they can support their workers. Another huge area is the fact that our own medical workforce is not well instructed in the managing the symptoms of menopause. And many women really struggle with even their own gynecologists that don't really, have a lot of experience in treating, the symptoms of menopause. And so this is another way where employers can make a difference by taking a look at their insurance policies and providing employee assistance programs that help women identify those specialists that do have a lot of understanding and knowledge of how to treat women that have extreme menopausal symptoms, because good healthcare can make a world of difference in women being able to stay at work. In our webinar, we heard from, medical doctors about how there's a small portion of women, not much, but there's a small portion, maybe 10% of women that do experience, really extreme symptoms that can include nausea, vomiting, just extreme hot flashes, inability to sleep, all of these things that can really be managed with a good healthcare. So that is another way. And when I think about the healthcare industry embracing this issue, it almost seems like a natural fit for the industry to really lean in and be a leader on these issues. And so I'm really curious after we get to the discussion part in hearing some of your thoughts about this issue. Next slide, please. Another area where thinking about supporting midlife and older women in the workplace is just recognizing how caregiving has had such an impact on women over their lifetimes. The Women's Bureau commissioned some research to try to quantify, what the actual cost is, and we found that it's not unusual for a mother to lose nearly $300,000 over her lifetime due to the cost of family care. And that can include caring for their own children, caring for their spouse as their spouse ages, caring for their elderly parents, caring for relatives that have disabilities. And particularly for older women, I think it's kind of common to think about younger women dealing with younger children, but it's really midlife and older women that continue to experience caregiving for their families. And it takes up an enormous amount of their time. We've estimated women that are 55 and older providing, roughly 26 days of full-time work, just trying to squeeze it into a year of unpaid caregiving. And so it's a significant amount of time. And a lot of these older women are still in the workplace as well. And yes, as Veronica has noted, some of us are older women still having our own younger children, and having multi-generation families where we're caring for our grandchildren as well. So it's an issue that more and more older women are experiencing. And again, a way that employers can help support some of these caregiving needs just with workplace flexibility, with support for childcare, with support for elder care, and a recognition that these women are shouldering a lot of responsibilities, and having a supportive workplace can make the difference between deciding to stay or reduce your hours or, retire early. Next slide, please. The last area that I want to talk about is our effort to eliminate gender-based violence, harassment, and discrimination in the world of work. And this is a really clunky, long title. We're often said, why are you saying world of work? What's the deal with the world of work? What does that mean? World of work means that any type of experience you have that's associated with work where you could be exposed to a violent situation, a harassing situation, a workplace violence. So that might include commuting to and from work. It might include working at a conference that's related to your work, a professional development conference. It could include having social events with people that you work with outside of work. Maybe it's a holiday party. Maybe it's drinks after work. Maybe it's a company picnic, things like that. So it encompasses more than what we just think of as the workplace as one unique place where you go to every day, but a place where you can be exposed to a variety of different situations that are kind of aligned with your work. Our current laws that focus on discrimination and harassment are very, very limiting. They don't necessarily address how you could have discrimination from a client, from a patient, from a board member. You know, it has these sort of narrow definition of employee and employer or coworker. And so being able to think about how people in the workplace experience, you know, harassment, discrimination, or even violent situations is just much broader than the way our laws sort of narrowly define some of these issues. And so the Women's Bureau has been working very closely with the White House, who issued the National Plan to End Gender-Based Violence, on trying to expand this definition and also talk about ways that employers can prevent workers from experiencing a gender-based violence in all these different types of ways that they are associated with work. We also have a partnership with the International Labor Organization, the ILO, and they have a convention to eliminate workplace violence. It has a very particular focus on gender-based violence and harassment, which we refer to as Convention 190 or C190. And the Women's Bureau website has like a whole page of resources devoted to this, which I will refer you to and make sure you have access to that. Next slide, please. So let's think about what it means for the healthcare workforce to think about gender-based violence through a gender lens. As you know, I'm sure you all are very well aware, healthcare workers have one of the highest rates of workplace injury and violence. And, you know, in the latest statistic, 2018 accounted for 73% of all kind of non-fatal workplace injuries and illnesses due to violence. And our Occupational Safety and Health Administration, you know, specifically calls out healthcare services and hospitals as high-risk places for workplace violence. And so they have some very specific, you know, prevention guidelines just for the healthcare workforce. But what they haven't done is think about how these workplace violence situations can very well be linked to gender-based violence. And so the Women's Bureau has been starting to engage in conversation with OSHA about this topic. In fact, on March 5th, we're going to be having a webinar that explores some of these issues a little bit further with OSHA you know, speaking at our webinar about what we're starting to recognize as the impact of gender-based violence in the workplace. And so what we are learning is that if you have a workplace that's 75% female, and you have you know, it's a known risk factor that, you know, these workers experience a lot of violence, often through patients or family members of patients, you know, people that are in distress when they enter the healthcare system and, you know, maybe not acting rationally because of, you know, the stress they're under, the pain that they're under, and they can lash out. But they may be lashing out not just because, you know, it's a healthcare worker, but because they may feel it's acceptable because that person is a female to be dismissive, to be rude, to, you know, be, you know, verbally or physically violent to that worker. And so one of the things that we would like to see happen as employers think about prevention is to talk directly to their workers and, you know, hear about those experiences and to sort of tease out, like, how are these incidents that are experienced in the workplace related to the gender of the worker, and what might we do to prevent it? This can include everything from, you know, signage to making sure workers aren't working in isolated situations, but that they're always a team of workers that are ready to support each other when they're working with you know, any kind of situation where they could be harmed in the course of their work. And also making it acceptable for workers to say, you know, this isn't acceptable. Yes, we know we have to take care of, you know, these people that are seeking our help from any kind of, you know, healthcare issue they have, but it's not acceptable for us to be expected to just deal with this. We have to do better about preventing it and communicating with not only our patients, but our community about the unacceptability of lashing out against healthcare workers, particularly those that might be linked to their gender. So this is, again, another area where I feel like the healthcare industry could really, be a pioneer in addressing this by looking particularly at how is, the gender of our workforce a factor in some of these incidents that make us so prone to have violence in the workplace. It's also, I think, something that we frequently hear about workplace burnout among healthcare workers, particularly during the pandemic. We know that our healthcare workforce is stressed and that many are beginning to get to their midlife and over years and say, enough is enough. I need to go do something differently. So again, looking at this issue, I think could be very critical to making a difference in how we retain our workplace and make the work experience a better experience for everyone. Next slide, please. So I'm sort of coming to the end of the amount of talking that I want to do on this issue. But as James and I were talking about, presenting this information today, we thought about some questions that we could continue on a dialogue. Some things that I'm interested in hearing from this group is whether your agency has ever thought about looking at workplace violence from a gender lens. And if so, what kind of supports might you need? The Women's Bureau, doesn't conduct focus groups, but we do have partners that work within the community that does offer a lot of support to employers that might want to do a focus group or a deeper look. Futures Without Violence is one of our nonprofit partners that can help, employers look at that issue a little bit further. And then, the whole issue of menstrual equity. I'm really curious to learning if any of your agencies have taken any steps forward on that issue, if you had any best practices to share. And if not, what you think about beginning that kind of a dialogue with people in your industry, with HR, with your senior leaders to see how you might begin addressing that. And if you begin addressing it, what kind of supports would you like to see the Women's Bureau offer to you? Particularly the healthcare policy, the insurance issue, that's just huge. And the amount of healthcare workers, even that we can get trained in addressing, in treating and understanding how to successfully manage menopause symptoms, I think is huge. So that's what I have, wanted to talk with you all about today. I thank you so much for inviting me to share this information. I have some resources to share with you afterwards, and look forward to continuing the conversation. Thank you.
Great. Thank you so much, Kelly. Can we get a virtual round of applause for Kelly? What a great and informative presentation. Some amazing statistics that we can all use to be able to move the needle on this issue. I would like to, we are not going to break into small groups today, but we're just all going to stay together. I would love if anybody would like to come off mute. If you want to raise your hand, I can call on you. Because I would love to, if anybody has, particularly this, the first question around, what, your organization has done around workforce violence and gender lens, or if any of the other questions jump off, would love to get some discussions going, from our folks. So, please raise your hand. Let me call on you to come off mute, for that. And, also in the meantime, if you have any questions for our speaker, if you want to put those in the chat, I can facilitate, asking those to Kelly. So I will look for volunteers if anybody would like to come off mute, and be able to share for any of the questions that have been posed by our speaker here. I will call on folks if we don't get volunteers to get the conversation started. Actually, Renee put something in the chat. Renee, would you mind coming off of mute and sharing your questions and a little background for Kelly on the Sentinel Network?
Sure. So Sentinel Network is a partnership between the Health Workforce Council and the University of Washington Center for Health Workforce Studies. And so we field a survey twice a year with employers. And so in the fall round, we've been seeing a lot of conversation around impact of violence in the workplace for healthcare workers around retention. And so we did ask a question about that, and I can put in the chat a link to sort of what came out from employers on that, but unfortunately, it didn't have a gender lens to it at all. It did seem to be more impactful in some types of healthcare settings versus others. So I'll go find that over here and plug it into the chat. And I'm just sort of thinking, and we can probably call on Stacy too, our colleague from DSHS who works on home care aides. But I was thinking we're going to be doing some listening sessions here at Workforce Board on the long-term care side of things. And I just thought I took a screenshot of this and sent it to the long-term care team, because I think asking about these issues in the focus group settings could be a really interesting way to elicit more information about what's going on. Because I at least have not seen, menstruation discussion, ever in my time within workforce, which of course, now that you bring it up, I'm like, yep, that's a tremendous issue, but it's so stigmatized and under the waterline. I think a lot of us don't think about impact on the workforce for that.
Absolutely, Renee. Thank you so much for sharing that. I will say to you that one thing that we've heard some employers say about doing focus groups or surveys is that some of them say, well, I'm afraid of what I'm going to find. Like, what am I going to have to deal with? I don't want to know, So one way to, I guess, anticipate that kind of resistance is to say, well, we're not going to fix everything overnight, but if we understand sort of some of these issues a little bit better, we can set some priorities and start small. And that can help workers go, okay, employers, can help break down some of the resistance they might feel to learning more and having a dialogue with their employees about these issues.
Fantastic. Kelly, I'm just curious. I know that your agency really focuses on the gender lens, but is there data that shows that addresses the intersectionality between gender and race in workplace violence? In other words, are women of color disproportionately impacted by workforce violence, or is that something that that really hasn't been addressed, or that data isn't super good just yet?
I don't think the data is super good. We haven't ourselves done that kind of a deep dive, but I think it probably, is going to be, likely that there is going to be higher incidence of workplace violence. I can, after this call, I can, ask around to some of my staff that's really been doing some of the research, and I'll share with you anything I find on that topic.
Okay. Great, fantastic. Any other questions for our speaker? Anybody else want to jump off of mute and engage in some of the poignant questions that were posed here?
This is Denise. My thoughts when listening to your presentation that went through my mind is, especially with the dealing with the symptoms that are more extreme and disruptive in work. If a female worker were to say that this is probably the cause of that behavior, that it would be perceived as an excuse or as a way to hide behind it, and and probably even female employees in the position to have to evaluate that will be looking at that. So that's even a challenge because it's something that it's been taboo. We don't talk about it in the workplace. And so it's not a policy around it. And so they will not consider those things as a way to address as a problem, as like alcohol, alcoholism. And so they have if you are alcoholic, it's disrupting your work, let's send you to, we'll give you one more chance and we'll send you to AA, right? But in this case, it's like, that's your problem. You need to find a way to control it. I'm just saying I just feel like that would be the response if we were to actually use that or come forward as part of what led to needing guidance or help or whatever. I don't know. Do you know, are you following what I'm saying?
Absolutely, Denise. I
Okay.
think you're exactly right, is that this subject is so taboo that it's more acceptable to be an alcoholic than it is to have a period and an extreme, of menopause. It's
Right.
like crazy when you really put it in that context. But that's where I think having more manager training and having support from EA programs where, a worker who may be having, symptoms, a manager can have a conversation. It seems like you're really struggling here. We have an EAP program. They have some support specifically for women that are going through a variety of transitions. I really would, feel like you could benefit by talking to them. That is sort of a way to sort of manage that conversation and, work with an employee that's having kind of disruptive, if they have disruptive behavior in the workplace, and to provide them with support so that they can, feel better and more confident themselves. But it's a long way until we get there. And, we're just scratching the surface, but, hopeful that we're at the beginning of this conversation and, maybe in 20 years, it's going to be, common to have these sort of workplace policies.
Well, thank you for bringing the topic forward because it's time, long overdue, to start thinking about it, and we're ready for it.
Awesome. Thanks, Denise.
Mhm.
Elizabeth, I see your hand raised. If you want to come off mute, that'd be fantastic.
Thanks. Yeah, so I work on the education side of things, training our next round of healthcare providers. But the conversation is interesting because I know in the past, we've certainly had conversations around supporting our students, around access to menstrual products, that kind of thing, which in turn also benefits our employees. But we don't talk about it in the context of our employees, which is kind of interesting. And I don't think that we've ever had a conversation with regards to menopause. And similar to healthcare, education, it has a high female work population or worker population. So I'm kind of looking at this and thinking, so in our DEI discussions, that I think I'm going to throw this topic out and see what happens. And it's interesting, Kelly, you mentioned EAP programs. Personally, I never would have thought of our EAP program providing support for these kinds of issues. Because when I get all the messages about what our EA program can do, it's never mentioned. And because we don't talk about these things, it didn't occur to me that maybe I could direct an employee to that group if these are the issues that they're facing. So that's helpful.
Yeah, I think that you're exactly right, Elizabeth. One of the things that I hope is a resource for you, if you want to bring it up when some of your DEI conversations, is the resource guide that we had after we had our webinar last year, which talks about, how even the medical industry doesn't have a lot of practitioners with specialties in menopause, and how women really struggle to find healthcare providers that can help them if they do have extreme symptoms and need help. So it's a great starting, resource. And, the only way that we're going to see some progress is to start introducing the topic. And I think your idea of taking it to the DEIA committee is wonderful. Let us know how it goes.
I will. I'll let you know. Thanks very much.
All right. Fantastic. I also saw in the chat, Stacy, do you want to come off mute and share what you placed in the chat with the partnership with SCAU 775?
Sure. Yeah, I was just trying to find the actual bill that started that work.
Stacy, yeah.
Sorry, I had unmuted. I was trying to find the bill.
Stacy, I think we're hearing a lot of background noise. I put you on mute, but I don't know if everyone else hears it.
Yeah, I heard it too.
Yeah, there's a lot of static. I'm not really sure why. Yeah, sorry, Stacy. Well, try it again. Yeah,
No.
if you want to maybe put it in the chat.
Yeah, I got it from the chat. So Stacey put in a comment that ALTSA is releasing a toolkit module for employers related to harassment, abuse, and discrimination. This work was based on earlier legislative work was done in collaboration with SEIU 775. And for those of you not aware, 775 represents and helps to train home health workers regarding the same. However, acknowledging this was this work was not necessarily done with the gender lens. So potentially, looking at 2.0 in the toolkit, I think with this information today, that might be a great opportunity. And sorry, Stacey, you're having the technical difficulties, but we're still there a couple years later. Denise, I see your hand raised. Do you want to come off?
Yes, thank you. Actually, it was in reference to Elizabeth's comment of not being notable in the educational pieces, but
Oh.
I inquired with one of my colleagues that is on the prevention training, not training, but prevention group. That anytime there's an incident that happens in any of our facilities, they're funneled to this group to decide what to do. Like it, are we going to exclude this person from going to that medical center, or how are we going to address this incident, right? And so I inquired about whether or not there is a discussion around this prevention around um, toward women, and they said no, because it's 80% women, so they don't have that lens, but it's but majority of the concerns that come forward involve men. And so this is kind of interesting. So I'm like, okay, well then maybe you need to come with it with a female lens, right? I mean, it's like, hello. So anyway, it's just like, thank you again for bringing this forward, because this is something that needs to be adjusted, you know? The
Yeah,
obvious. It's like the obvious not being factored in. It is just the most bizarre thing.
it
Awesome.
is. But
Oh, go ahead.
yeah, when you consider that it's cultural, that this is like for generations, women have been the other. The whole world revolves around the male standard of work, the fact that there might be a female caregiver at home taking care of everything that worker needs to get to work. So it's not, unusual that, people haven't thought about it. But it's up to us to start the discussion and to see how far we can take it. So I'm excited, Denise, to hear what your conversations lead to, and anything I can do to help, please let me know.
Great. Thank you.
Awesome. Lisa, I see your hand raised. If you want to come off mute, please.
Sure, thank you. Just to echo what Elizabeth was sharing about approaching it from those we serve in workforce development, bringing people into healthcare. And many of the people coming to our program have experienced workplace violence from a gendered perspective and are bringing that with them into like this new career that they're passionate about.
Mm-hmm.
So they're cognizant of it, and we approach it from that way, but also adding on these menstrual equity issues. I know that there's a lot of trepidation or uncertainty about whether it would make them a good employee to even ask this question when they're so new to the industry. So thank you for bringing this up. And it's something we need to discuss in our own organization as well. But I would love to know if any if there's a direction we can take it for employee like resource groups or EAP programs, so that that question could be asked somewhat confidentially without regard to like fear of work performance when someone is so new to making this their chosen career path. Just a
Right.
big thank you.
Thank you for that.
Awesome. Wendy added in the chat that our workforce is 77% female, and we believe our EAP policies respond to gender impact, yet I haven't heard us talk about menstruation and menopause issues specifically. Very helpful presentation, and we'll share, which is awesome. So thanks again, Kelly. Just a last call. Anybody else want to come off mute and share something? You know, whether it's for one of these questions, or you know, I think what I'm hearing in the group is that you know this has been illuminating to really center some of these issues, but you know, solutions. I think we're still ideating on those, and probably have some questions to ask about some existing resources and ensure that they're framed up a little bit differently. But again, you know, the first step to addressing any problem is illuminating the problem, and then we can start to work towards solutions. So I think it's a fantastic presentation today to accomplish just that.
Thank you so much, Ryan.
All right. Well, let's get one more virtual round of applause and some fun emojis out for Kelly for joining us today. Thank you so much. It was asked in the chat. This presentation and the recording will be available afterwards. We'll either push it out to the mailing list as well as be able to post that information on the HILT website. And if you want to reach out to Kelly directly for more information or for some assistance, we can see her contact information here. Thanks once again for joining us. This has just been an awesome spotlight event for our February, our probably only February 29th meeting that we will ever have. So thank you so much, Kelly, and you are welcome to stay for the updates of the rest of the meeting. But again, thank you just so much for sharing your time today.
Okay, thank you so much. I am going to head out, but I so appreciate talking to you all, and just enthralled that you've received this information, you know, so receptively. You know, you're so open to it, and love to hear any conversations you have where we can support the work that you start to do to introduce these conversations. Thank you.
All right,
Thank you, Kelly.
fantastic. All right, so we're a little bit ahead on our agenda, and that's a good thing because up next is going to be our committee and work group updates. And so I believe first up is our behavioral health work group, and we have the fabulous Vanetta Barton from the University of Washington to share some updates with us today.
Good morning. Good morning. It's great to see everyone. Just one moment here, just getting set up. I was putting away my notes from the presentation, which was quite good. So thank you. So really just knowing that everyone, or not everyone, but most people are familiar with the work of the Washington State Behavioral Health Work Group, I thought I would just take a little bit of time. And can you hear me? Is my volume okay? James, is my volume okay?
Yes, we can hear you just fine.
Oh, thank you. I got a little message there. So really just wanted to give an update. I think most people are familiar with the Balmer Behavioral Health Scholarship Program, which is one component of the Washington State Workforce Development Initiative. And so I thank you again for the opportunity just to give an update. So since November, we've welcomed 4 additional students. So you might recall we're sitting at about 130 students or so. These are first-year clinicians, first-year clinical mental health counseling, and marriage and family therapy, and social work students who've signed on. And I'm just going to, again, give highlights and answer questions. So no PowerPoints for this particular meeting. But we're really excited that students have signed on to make a commitment to train and work for 3 years after graduation in a community behavioral health agency that provides 3 essential services: mental health counseling, substance use disorder and rehabilitative case management. And so currently there are 12 universities participating in the initiative. And with our focus on clinicians of color, we're hopeful that Heritage University in Yakima will be joining us with the fall 2024 cohort. So very excited about that. Another highlight is that we're supporting HB 1946, which will create a state behavioral health core to provide additional career focused scholarships. And so we're hoping that the bill will pass through the Senate rules. I think it's passed last night or this morning and move to a Senate floor, to the Senate floor for a vote. And so currently universities are selecting their incoming students. And our biggest challenge is the delay of the FAFSA form, which is impacting students across the nation. I know others will be talking about the March 21st career event. So on a related note, I'll share that when it comes to completing Washington application for financial aid, the FAFSA form, Washington State is 41st in the nation. In addition to federal support, our state's financial aid goes unused each year. And so the Washington State Behavioral Health Workforce Development Initiative will reach its ceiling in these next couple of months. And we know that financial aid is valuable. And so this fall, we are really hoping that a publicly funded conditional scholarship program would greatly help potential students, specifically students of color, I should say. And so these are highlights of the Behavioral Health Workforce Development Initiative. Our class of 2022 and class of 2023 are in the workforce, and we are just really excited for the incoming class. So any questions that I might answer?
Vanetta, could you share that House bill one more time? I'd love to put that in the chat, and that way folks can call their senators and representatives and advocate for that.
Yes, it's 1946, and I can put it in the chat or you can, but yes, 1946.
Awesome, thanks. And 10 to 15 calls to a representative or senator make a difference. So
Yes.
particularly for our industry partners, getting a call from somebody makes a huge difference. They're super busy, so highlighting this is could be a great opportunity for some HILT advocacy.
Are there any questions?
There was a question. Is there a link to the online? Is there a website or an online presence for the work group?
Yes, for the work group or for the application?
I think the question was for the work group.
You know, I am not sure how with the leadership transition, I'm not sure how that's set up right now. If someone wants to email me at vjbarton@uw.edu, that's vjbarton@uw.edu. I can certainly follow up.
Okay, fantastic. And then there's a question. Could you please repeat how many students are participating in the incoming group from Wendy at Children's?
Yes, so we have 132 applications from fall of 2023, and we are sitting at about 330 students and graduates, so 330 recipients. Our goal is 415 based on the funding from the Balmer Group. So we will definitely max out in fall of 2024.
Fantastic. That's awesome. And in order to add to a link to the application would be great as well, which I think we can, if we can, if we could throw that in the chat and we can send that out in our follow-up email as well.
Great. I'll put it in the chat after I
Awesome.
sign off here.
Great. Well, amazing work. You know, I've done a lot of grant work and opportunities, and for this project to be ahead of schedule with things is just absolutely amazing and speaks to, I think, both the need for this, but as well as the collaboration that's happening between all the partners, and of course, your critical leadership, Vanetta. So thank you so much for joining us today and sharing those amazing updates.
Well, thank you. And I will say the HILT and the promotional activities that you all do or we do has been a great, great help. So thank you, and I look forward to the rest of the meeting.
All right, fantastic. Well, next up and counting down the days to our capstone event, our Sound Careers in Healthcare event. Tatiana, would you like to come off mute and share your updates, please?
Hello, everyone. In case you guys didn't catch it, my name is Tatiana. I am the Events and Communications Manager for WOBS. We're currently planning the Sound Careers in Healthcare event right now, so I've got lots of updates for you regarding this. I think I will be sharing my screen for this because I have a separate presentation, but all of the information that I have in here will be included in the follow-up packet that James will be sending out at the end of this meeting. So let me go ahead and get this ready in presentation mode for you guys. Can everybody see my screen? Yes? Okay, great.
Yes.
So as I said, we have a lot of really, really big updates for you guys regarding the Sound Careers in Healthcare event. Lots of moving pieces here. So at first, we're just going to go ahead. James, do you think that we need to show the video for last year? Do you want to go ahead and do that now, or?
Yes, you have time if
Yep.
that was part of your presentation.
Well, I mean, we had shown it like last time, and so I just wasn't sure if we wanted to show it again. About 6 minutes. We have blocked quite a few. How many minutes do we have on here? 20 minutes for my presentation? Yeah, okay.
We can also include it into the slide deck as well and kind of include that link.
Okay, yeah, we'll go ahead and we'll do that instead so we can get through the rest of these updates real quick 'cause it's a lot. So, okay, great. Thanks for working with us. So just to give you guys a quick event overview, this is an event to promote healthcare career awareness to underserved high school students. We have one in-person event and we have a virtual event. And so here's the details for both of them. The in-person event is going to be on the 21st. It runs from 9 a.m. to 1 p.m. It is in the UW Husky building. We are expecting at least 500 students to attend, and this year's theme is Imagine a Future in Healthcare. For the virtual event, that will be happening the following week on the 28th. It will be done over Zoom, running from 9 to 11:30, and we are expecting about 300 high school students to attend this event. Or the theme, we're always trying to look for different ways to kind of incorporate it and make sure that it is present within the event itself. So these are some of the ways that the event aims to do that, primarily by focusing on high school students. A lot of early job career exposure predicts higher job quality. When students are aware of what the career opportunities are for them, they are more likely to engage in those opportunities. And we prioritize students that are furthest from educational justice. So this is BIPOC, low income, ESL, first generation, et cetera. This to increase diversity in the healthcare workforce. I don't think I have to tell any of the healthcare people here that there is a massive gap within representation within the healthcare field for these communities as well. And it's really important for patients and stuff to see people that look like them, that come from the same places as them, that have the same experiences as them when they go and they see a healthcare provider. And we have data-driven promotions around the careers to reflect the industry needs itself. For the theme in action, we have a couple ways that we always ensure that the students are able to imagine their future in healthcare. And we do highlight a diverse array of healthcare pathways and resources. This is in an interactive setting. The students have a lot of hands-on activities that they get to do. They get to interact with different colleges and programs that offer healthcare career placement access as well. So HILT, we do lead students through activities. As I had just said, they can actually just see what this looks like for them. It's really cool. Some of these activities just involve, simple demonstrations. Other activities are them actually doing some stuff. So we also aim to make sure that the event is equitable. We implement EDI practices, such as hosting training for planning teams, identifying students furthest from opportunity, et cetera. We also just make sure to keep inclusive environments as well. So this year, for example, because the event is happening during Ramadan, we're going to have a prayer room or a reflection room for Muslim students who would be attending this event who need access to that. We always make sure to ensure that we are showing a diverse career path and professionals. And a lot of these professionals, it's important for them to also reflect the demographics of the students that are in the audience. And we have actionable resources there as well. We provide students that allow them to pursue their interests within healthcare, apprenticeships program. Even within this event itself, we have some ways to engage the students. One of these is a postcard that one of the subcommittee members is making. It's a very cool postcard, and it has like on the back of it, it says, what are my next steps to kind of usher myself within, this, or to pursue this dream of mine to get within healthcare. And we're going to be giving these students out these postcards like at the event. They will be filling them out, and then we will be sending them later so that they can take a look and reflect to see like, have they made these steps, etc. It's also just a nice reminder for them as they're going on throughout the rest of the school year. So for the event updates itself, for the in-person updates, we currently have 618 students that have confirmed their attendance. We are still working with schools to complete all of their registration forms. We are expecting that there is, going to be a small drop off just in terms of numbers. Students get sick, they can't get their permission slip signed, et cetera, all of those things. But currently we have 618 spots that are filled up here. And we have 8 different school districts that have been invited. So it's really exciting news. We are always looking for ways to expand this event. So, it's exciting to hear the interest that is drumming up within for this event specifically. We have made a couple changes to reduce the congestion in the ballroom. The college tables will be moved down to the first floor. Previously in last year's event, all of the college tables and the industry tables were both in the ballroom with all of the activities, and it was a really, really big and it did cause like a lot of congestion. It's one of the main points of feedback that we got about the event. So we are working with just to find logistical solutions to this that can help alleviate some of this concern. Of course, with 618 students attending, there will be traffic problems in general. There's not a way to completely eliminate that, but we are coming up with ways to alleviate it. And we also have a new arrival check-in process for the schools. So rather than having the entire school and all of their students come in to register, we're going to have 2 volunteers that will go out to meet the schools themselves. One will bring in a chaperone from that school to hand them what we're calling welcome bins for the schools. And it's going to have tote bags for the students, lanyards to delineate what their status is for the media release, other event materials and orientation. So we'll have one chaperone coming in to collect all of those materials. We'll have another volunteer going out to the bus to orient the students about their expectations and what they can expect for the event. So hopefully that will also alleviate a lot of congestion there. And then for 2024, as I mentioned earlier, we have a reflection and prayer space that we added in there. It is available within the hub. For the name badges that all of the students receive, it's going to say, they're going to fill in their name, and underneath they're going to say future blank, and they can fill in what position they would decide to do in the future. So future nurse, future dentist, etc. And those will be going in with the lanyards that they will be taking home with them as well. And then we have a selfie booth, photo booth that's going to be on the first floor, and that will be the students' last stop. We think that this is just a really fun way to engage the students. They, everybody loves a photo booth. I don't care what your age range is. And we're going to have a volunteer manning this as well. We're going to have, some props, etc., for the kids to try on to put in their selfie. So some lab coats, a stethoscope, etc. So we're really exciting. I think it's a really fun way for the students to engage themselves in there. And for the virtual event updates, this year's event is going to be a pre-recorded event. Last year's was a live stream. We have shortened the event by 30 minutes. This was also due to some feedback that the live event was just like a little bit too long for the students to stay engaged, which we understand 3 hours is a long time for students to be staring at a Zoom screen. It will be on the Zoom platform itself, and we are currently, just as we are with the in-person event, we are working with schools on attendance and registration forms. So, does anybody have any questions so far? Yes.
What's the capacity?
For the students?
Yeah, total capacity.
Currently the capacity was at 600. So we just had a couple of schools that had a little bit that got a little bit overzealous in terms of inviting their students, and some of those students have already registered. And I don't think it's a particularly good look to go back and be like, you have to decide which ones can't go anymore. So we are we're hoping that at least the way that we stagger some of the school arrival times, etc., will be okay with the extra students that are coming. And so and we do also we want more students to be coming to this event. So it's just exciting that we have over the amount of attendance, even though it's a little bit nerve-wracking for planning purposes on my end. Denise, yes.
First, I just want to say I love the additional things you're doing to enhance the experience for the students. Great job. And second, I am curious, how are you alerting the students where the prayer room is? And can you do that in advance to let them know that that will be available?
Yes. So all of the teachers are going to be receiving some orientation materials about what to expect, etc. We're going to have that information in there, and we are going to have one volunteer or at least one or two volunteers that will be that will have the keys to the prayer room itself, and they will be the ones that will be guiding students from whichever location they're at within the hub itself to go down there and utilize it.
And what floor will it be on, the first or second floor?
So the prayer room itself, I actually think, is on the subfloor. We are confirming that with the hub right now.
Oh, okay.
Yeah.
Okay. Thank you.
And Tatiana, do you still in need of volunteers for the day?
We sure are, which is one of the asks that we
Sorry.
were going to
I
have.
I jumped ahead of you. My bad. I'll just
No,
go
that's
back to
okay.
you now. Go ahead.
No, that's okay. Before I go, does anybody else have any other questions? No? Okay. Oh, Bill, yes.
I see a hand raised. Bill.
Hi, Tatiana. Thank you so much for your presentation. One of my colleagues participated in this last year doing an activity with the students. And I guess my question to you would be do you have any examples of what some of the most successful activities were, or most attractive or interesting activities were, just to get a sense of what was really engaging the students? Because I think depending on the field or the career, I think it can sometimes be challenging in a very frenetic environment to sometimes get attention. So just trying to get a sense of what that might be.
Yeah, so we have the Doctors for a Day program is providing a lot of activities, but we've actually had some other outside organizations that want to provide them as well. But the students in general just like the activities all around. Nursing, for example, is going to have 3 different activities. One of them is Stop the Bleed. Another one is I hope I'm pronouncing this right. I always mispronounce it. I think auscultation. And another one is going to be baby swaddling. And so students just, I think in general, just really like any time they can just like take a look and like touch things and sort of like do actual or do mock procedures themselves. So I don't have the feedback data from like what the students liked the most last year. I did just start at WAVS earlier back in January. So there's a lot of data that I just haven't had a chance to kind of like really dive into because we've been planning, but I hope that sort of helps answer your question a bit. Okay, any other hands? No. Okay, great.
Well, this is Denise. Sorry, I didn't raise my hand,
Oh
but
yeah, no, that's okay.
to answer Bill's question, I found that the students were really intrigued with having interaction with physicians and learning more about that work. So even if they don't have any hands-on, just being able to talk to a physician was a big deal to them. But you're right. Alternative, if your colleague that's not coming, that is coming, is not a physician, has something hands-on, does keep their interest, but the cooler the better. So however you can, you know, make that job exciting,
Yeah.
the better.
Thank you for that, Denise. Okay, we're gonna go ahead and move on so we have enough time to cover the rest. So for volunteer status updates, we currently have 118 volunteers registered. This does, however, include occupational leads and tabling leads themselves. You can see down here what the goals are, especially what we have for this year. So for logistics specifically, we do need some help there. We are at 30 people currently. We need at least 48. And we have 37 people individually registered for different occupations. Last year was about 108. This number, though, I just wanted to note that it does not include for the activity volunteers that haven't submitted those forms yet. And we have 33 different tabling or different organizations that will be doing tabling there. Last year we had 32, so that's one extra.
All right. And Tatiana, before we move on from that, we have a question in the chat about how do you sign up? Can you throw that link into the chat for folks to sign up and volunteer?
Yes, we will be sending all of that information as soon as that is done. And actually, Christina, could you send the link within the chat?
We have the just a few slides away, Ryan.
Okay,
we're gonna make that ask. So hold on.
I'm just jumping the gun here today.
Okay, this is just a quick breakdown of the activities that we have scheduled so far. So you guys can see the numbers for each different field and what some of those activity types are themselves. The ones that are in progress, we are still confirming all of this stuff with those tabling leads, but these are, for the most part, these are commitments that we have. So this is for the confirmed activities. These are not including the ones that are in progress. We have 16, and I think last year we had 18, so we're very, very close. And I think we might actually be over than what we had last year, which is really exciting. And then this is just the this is just the list of the organizations that are going to be providing tabling at the event itself. So you can see the industry resources. These are a lot of like career programs and employers, and then the community or the colleges, which are the community resources. And we have 11 of those. And now here's our call to action. We do need more volunteers. So please, please, please reach out to your organizations and networks. These links are going to be sent to you guys. The volunteer interest form is in there. We have a copy and paste email template that is also linked in here that you guys could just borrow and send that out to, to your networks and just blanket wise. And we do also need some more financial sponsorships, which we'll be getting to in just a second. And so I will also be linking the sponsorship tiers for those who are interested. And so then this is our financial sponsorship update. I think this is very good news considering how much it's been hurting cats trying to get some of these things. But our goal is to raise $41,750. We are at $37,379. So we just need $4,371 to hit our goal.
All right, fantastic. I did see a question in the chat about, are you looking for more tabling organizations?
No, so we've actually reached, I believe that we may or may not have reached our limit on the tabling organizations, but like I said, we do need a lot of logistical helps, and I am working with a lot of the occupational activity leads. Some of them may actually also need help with some of those occupational activities, so that's also a way that you guys could help out if y'all are interested.
All right. Fantastic. So we're going to take a few minutes here. I would like, if you have not signed up to volunteer, and even if you're planning to come out and you just haven't filled out the form, that's okay, but we're just going to give a couple minutes for folks to go ahead and do that. So if you can click on the link that James just shared for that Google Doc, and please be able to put your name and information in. Even if you've told somebody on the committee, or you've told Tatiana or James or myself that you're going to be there, there is absolutely no way with the size and scale of this event that we can keep track of that in our heads. So please, please, please sign up. If you're not sure you've signed up, please go ahead and fill out the form, because we do, want to have a good track of who's going to be there. And within your organizations, please share this out to get some of those initial volunteers. This is a great way for folks to be able to engage. I think, I'm not sure who had more fun last year, all of the students that were attending or the folks that were coming out. I don't think I saw Denise stop smiling the entire time. I mean, in general, Denise always has a smile, but she had 6 hours of just pure joy on her face. So this is a great experience, particularly if you have young and emerging leaders, and particularly if they came from these high schools. schools, or they face some of the barriers that these students face, coming out and just having those interactions with students and being seen makes all the difference in the world. So this is an incredible event, you know, and I think it's one of the things that HILT can really point to with the point of pride. And on the financial aspect, so just a reminder, our workforce development councils in King County and Snohomish, the Workforce Snohomish and the Workforce Development Council of Seattle King County, have funded the position at WAB. So Tatiana's hours that she puts in, all of the staff time to do this, that is all being funded by the federal workforce system, but the federal workforce system can't do some things like buy lunch for 618 hungry teenagers. So we really need that. So if your organization does have some budget dust out there to contribute, please reach out to either myself, James, Tatiana, or Christina, or heck, all four of us. We will find a way to make that happen. We are happy to give data back to you. So if you've got a grant that's a little bit underspent and you'd love some numbers for that, we will be sharing all this data out, and you can be able to share that data, you know, with your grantors as well. But again, yeah, and again, thanks to all the industry partners that have stepped up to be able to contribute. But we do need just a couple more just to be able to get to our goal. Would also like to give a shout out to the City of Seattle Office of Economic Development. So as part of the work that we do for them and their support of HILT, there's $10,000 from the City of Seattle going to this event. So you just want to call out and recognize that contribution from our city. So again, two things to do. Hopefully everyone has clicked on that volunteer form or has sent that to at least 5 or 6 friends of their organization to do. And if you do have the capacity to be able to volunteer, please reach out to one of us. And let's get a round of applause for Tatiana and Christina. This is a lot of work to pull off. Tatiana, you know, came in a little bit late in the game, but man, has been super organized and moving this forward. And I know we're not quite across the finish line yet for that, but Tatiana, it is clear that you are centering equity. You are hyper organized, and wow, like I mean, I think I'm not sure which is more popular, Sound Careers in Healthcare or a Taylor Swift concert. So nice doing the outreach.
Thank you. So I know that we
go ahead.
Yeah. So we do have a couple more slides, but I know that we are
no,
tight on time, that we have
an
agenda to follow. Okay, great. Yeah. So the next couple slides are just so that you guys can get an idea of what the layout is going to look like and how students are going to be interacting with all of the different organizations. These are also going to be part of some of the orientation materials that tabling and occupational leads are going to be getting early next week. So if you, sorry, we'll go ahead and we'll get into that. So you can see the program flow that we have here. We will have access to the hub as at 7:30 a.m. James, that was finally confirmed. I know that we had that question out there for a while. And from 7:30 to 9:15, we are expecting all of the volunteer check-in and venue setup to kind of like go through and finish up. Students will start arriving around 9. We are planning their arrival time so that they are staggered to, again, alleviate some of those congestion issues and to not just have like a big, you know, barrel of kids like coming in all at once. The ballroom tours themselves will be starting from 9:15 to 12:30. This is when the students are going to go in there. They're going to interact with things, you know, do all of the activities, talk with a lot of vendors and employers, etc. Lunch will be starting at 12. The lunch is actually tied to the event survey that we are going to have some of the students do as well. So they will be directed to do that on their way to lunch. And then around 12:45, we'll start wrapping up the event itself. For the event layout, this is, like I said, you know, like we mentioned, it is at the UW Hub. And so this is just like some general info for you guys in terms of just like how things are going to flow. We have a volunteer check-in that is going to be separate from the student check-in. Student check-ins are going to be coming in from the north entrance, since their buses will be parking around that area. This area down here in the hub they call it the street. That is where we're going to have all of our college tables. And so this is where students are going to be guided, after their lunch to as their last thing before they go and take their selfie photos. This is also an area where we thought, if there is a lot of congestion or traffic up in the ballroom, we can have the students tour the colleges first to sort of buy a little bit of time and space up there. And then the photo booth will be directly across from that in the big lounge area that they have. On the second floor up here, you guys can see the volunteer hub itself. So everybody that is actually going to be a volunteer participant in this, you will have a place to drop off your stuff and your purses and bags and jackets and everything. We're also going to have some coffee and pastries available for the morning in the morning for everyone. Students will have both lounges for lunch to sit and have lunch. Their lunches and surveys will be picked up right here outside of the ballroom. And we do have a separate space for lunch overflow that will have tables and chairs inside for the students. In the ballroom itself, we're going to have another slide that comes up next to will display this a little bit more clearly. But this is kind of the general layout that you can expect. So we're going to have all of the different stations with all of the different activities on the sides out here with the resource section in the center. And so this is just a bit more in-depth look at the ballroom tour and activities, just kind of general layout that we have. So we will have a total of 8 to 10 sections that will consist of hands-on activities. There might be several different activities happening within each section itself, with the resources and the industry resources and employers, all of those tables down in the center as well. The reason that we keep these in the center and not all of the activities together is because students tend to do the activities and they get excited and they're like, okay, bye. And so we wanted to be able to ensure that they are still able to engage with some of these industry resources themselves before they finish out their activities. And then just in terms of what interacting with the students look like if you were doing an occupational activity, et cetera, we'll have however many sections happen, or however many tables per section with the HILT volunteers, et cetera. And the students will be split up into groups of 5 to 10, and they will be, and we will have ballroom guides that will be directing them to the exact tables that they need to go into. I realize that I did not fix the lines on this, so I'm so sorry about that. Please ignore those. So. And for the resource section, it's going to be pretty similar as well. We're going to have a big open space in the center here. You can see these are all the students that go to all of the different tables with their chaperones as well. And I think that's it. We're done here.
All right, just a couple quick questions in the chat. Will volunteers get info on parking, arrival time, assignments, everything beforehand? Yes. Okay, but only if they sign up on the Google Doc, right?
Yes, and we need your email more than anything. That's the important part for this, because that's how all of the orientation materials will be sent out.
Okay, and then a question, is there an elevator for staff to bring up boxes from the to the higher floors? Yes. Okay.
Yes, we will have a loading dock. That information will be in those orientation packets as well.
All right, outstanding. Fantastic. Well, thank you, Tatiana, for that. I know we have the calendar countdown going, and I know I'm glad we had this extra day in the planning cycle to be able to do that. So fantastic. And again, thanks to Tatiana, to Christina, all the WOBS team that has been working hard on this, connecting both our industry partners and to the K-12 partners to make this an amazing event, and look forward to seeing everybody there in person in a couple weeks. So our last item of agenda we're going to pivot to are some program spotlights. So one of the things we wanted to do is lots of our support partners here at HILT have amazing programs going on, and so we wanted to highlight a couple of those. So as you can tell, so our first one that's up is going to be the Exploring Careers in Healthcare Opportunities, or ECHO program from Snohomish STEM. As you can see, our event is already at our capacity. So our friends in Snohomish County are also going to help lead this charge with some career exploration in partnership with Career Connect Washington. So Alyssa, I will let you come off mute and share about ECHO.
Awesome. Well, thank you, Ryan and James. Hi, everyone. I see some familiar names in here, so great to see y'all again. My name is Alyssa Jackson. My pronouns are she, her. I'm the director of Snohomish STEM Network, but also co-director with Jenny Veltri, who's here in the joined us as well, for Career Connect Northwest. So with my Snohomish STEM hat, we serve Snohomish County, but with my regional Career Connect Washington Northwest hat, we serve Snohomish County, Skagit, Whatcom, Island, and San Juan. So I'm excited to talk about the ECHO Tour, which stands for Exploring Careers and Healthcare Opportunities. The ECHO Tour is a dynamic career exploration program designed to provide interactive, multidisciplinary experiences to high school students. At least for this spring one. We are also looking at doing one specifically for middle school students, so we'll see how that comes along. But the ECHO Tour brings together students from more than 20 high schools in Snohomish County, so all of them were invited, as well as the alternative high schools, and we're even working with our workforce partners who serve the out-of-school youth. It's a 3-day event, March 18th through 20th, so there'll be a new group of about 200 students each day. And we have a range of volunteers, a range of career speakers that'll be covering nursing, radiology. We have, we're still, I think, looking for some dental, actually. That one has been an interesting one to recruit for. And I think there's nutrition, there's some dialysis, there's memory care, behavioral health. So quite a range. It's meant to be, well, career exploration. And this is really helping to serve the demand. As many of you know in this group, a lot of students are interested in going into healthcare careers, and we just need more and more of these career exploration programs so they can find out if it's for them, if it is for them, what they should do now in high school or middle schools to help prepare them to go beyond high school. And this event is, really based off of another model that we did with Career Connect Northwest, which was a wave tour. So that one's on the trades and construction industry. And so this one builds off of that and goes into healthcare, and who knows what other sectors we'll add next time. The excitement for this has really grown. So yes, we're running it in Snohomish County right now, in part because of some special funding we got. But there's heavy interest to continue growing healthcare career exploration up to Skagit, Whatcom, and beyond. So wanted to share that. I think we still have some slots left for volunteers. So it is the same week as the Sound Careers. We've kind of already talked about it, that it's just a sweet spot. It's right before spring break, and so many of the colleges are spring break for K-12, but the colleges are often out that week. So anyways, lots of programming happens that week. So if you all can't do the Sound Careers, or if you're available to do both, let us know. We can feel free to reach out to me. There's a QR code there on screen. The bit.ly/ECHO Tour, that'll take you to an interest form, and that's it. So wanted to share what's going on as we grow healthcare exploration, and see if there's any questions.
All right, fantastic, Alyssa. And we are kind of doing a little bit of speed dating here with the program updates. Unfortunately, Lise from Career Path Services wasn't able to stay on this long. Something else grabbed her away. So James, I think you're pinch hitting for her slides.
Yes, and it looks like Lise just entered the meeting. Hey, Lise.
Oh, she did. She came back. Oh, fantastic. All right, you're off the hook, James.
Thank you for stepping up for me, James. I was supposed to meet a previous graduate, but we rescheduled. I just wanted to share out again. I know you hear a lot from me about CareerWorks Medical, so I appreciate your patience. But if you haven't heard of CareerWorks Medical, we are a free job training program for young adults from underestimated and underserved communities here in the Seattle, King County, Snohomish area, partnered with many of your organizations. And we have graduation next week. So I've got a few stats here on who we serve and how we do what we do in those 8 weeks to support individuals looking to make that leap, primarily from customer service, retail, maybe fulfillment center type roles into serving their community by way of non-clinical positions. So patient service representatives, call center representatives, supply chain techs, inventory, pharmacy assistant type roles to get them that start and build out a career path. The really cool thing that I love doing in this job is supporting those individuals past that 8 weeks. We offer that as part of our program so that you know that they have a resource to reach out to about, external from the organization about how do I navigate this resource, or I have a question about, this interaction. So we cover soft skills, we cover industry terminology and content course curriculum that's been developed by our partners, including many of the organizations here. And if you have direct questions about that, I would be happy to show you around our LMS, talk about those topics in depth with you a little bit further. Can we slide to the next slide, please? So as I mentioned, we are having our graduation on next Tuesday, the 5th. We're expanding our graduation process. Typically, it's been held on one day with further interactions scheduled independently after that. But we recognize that one day is really hard to make so many calendars work. So we have an open invitation to our graduation celebration. If you would like to see what we're all about, if you would like to meet the current cohort or hear their stories, or hear from the lovely Rosette Boteo, who will be kicking off our celebration that day, we will be online from 10 to 10:30. Following that, we are scheduling organizational employer interviews with our graduates. And I do have a participant list to share if you are interested in connecting with them or know someone who might be. So my contact information is there. I'll also put it in the chat. And I look forward to welcoming you there that day.
All right. Awesome. Thanks, Lisa. Really appreciate this. This is a fantastic program, and graduations are my favorite thing to do at SGI from our cohorts in healthcare and as well as our other pathways. So our third program spotlight I want to do today is we have Kamal DeCampos from the city of Seattle. Kamal, if you want to come off mute and share about the Seattle Youth Employment Program.
Yeah, thanks, Ryan. I really appreciate it. Oh, here we go. Can you guys hear me now? We're good? Okay, awesome. Cool. Yeah, so thanks, Ryan. Thanks, James, for allowing me the opportunity to be here to speak to you all. So my name is Kamal. I'm the job developer with the City of Seattle's Youth Employment Program. If we can move to the next slide. Yep, perfect. So we're a workforce development program. We've been around for over 50 plus years. I think this year we celebrate our 51st year. And one thing that's been really prominent for us is our summer internship program. So every summer we host about 250 youth and young adults from underserved communities and areas, and we provide them with workplace opportunities to kind of help break down the barriers that are set in place for folks, from like from backgrounds that need a little bit more support, right? In those communities that need a little bit more support and resources. So that's kind of our goal. We provide wraparound services for all of these youth. And, I'm here today because a lot of our youth are asking for hands-on healthcare internships and also like behind the scenes healthcare type roles, whether it's nursing, whether it's dental, right, eye, vision, or anything else, right? We know that healthcare is a really big world and field. And for the youth that we serve, they really just want to, just get in, right, and immerse themselves with that. So that's what I'm here to talk to you guys about. We have a dedicated team of counselors that provide support for these youth. We provide also support services that cover costs that, maybe they aren't able to cover themselves, whether it's like specific clothing, like scrubs, or like materials for work, and transportation, and also food and housing support as well, if they need that. If we can move on to the next slide. Cool. So we serve youth and young adults between the ages of 16 to 24. Well, we try to be very intentional with the impact that we make here. So we do ask that they reside in the Seattle area or they're closely affiliated with the Seattle area in some way, shape, or form. Like maybe they have a family member that they live with in the summer in Seattle, or maybe they're attending a Seattle public school or a Seattle college or university. We also, again, try to provide the need to the folks that need it most. So we do look at average median income as a factor of who is able to be eligible for the program. And again, coming from those underserved communities, right? So a majority of our folks in our program are BIPOC individuals. And the youth that we serve could either be in school, out of school, maybe some of them have college degrees, maybe some of them just graduated high school, or maybe some of them are still attending college. So we serve kind of a wide range of folks with different experiences here. We can go to the next slide. Cool. So we have year-long programming. Obviously the summer's coming up, right, in the next 3 months or so. So that's kind of what we're gearing up for. But we also provide other opportunities where youth and young adults can learn and also earn some money. So we have some foundations programs that are centered around coding, IT, nursing. We partner with Swedish Hospital for that. And then also just like learning about any skills or tools, right, that are going to help youth and young adults either land a job or take the next step in their career. So some things that we cover during the Learn and Earn sessions are going to be resume building, networking, LinkedIn's, financial literacy, and a whole bunch of other things as well. And we make sure that the interns are paid, so all of our programs are paid. So during the summer internships, youth and young adults are getting paid $19.97 an hour, which is the new Seattle minimum wage as of this year. And during the Learn and Earn foundations, they are paid a stipend. And the stipend depends on the foundation or the career that they're looking to take the foundation courses in, because the foundation courses kind of have different time frames in which we serve. All right, we can move to the next slide. So here's kind of a breakdown of the different programs that we offer. So we got the Learn and Earn Foundations, where they're learning life skills and soft skills developments for work. We have the Foundations Internship, which is going to be a placement with the City of Seattle or community-based organization. That's going to be that summer internship that I talked about. And then we have a Learn and Earn, which is Pathways. That's going to be more so focused on the specific careers that youth are interested in. And that goes around the summertime. So it could be fall, spring, and winter. And then we have some other pathways through the City of Seattle that are more professional internships. For the most part, you can think of it as Learn and Earn, Foundations, Learn and Earn 2 pathways, and then internships during the summer. All right, we can move to the next slide. So some objectives here are to provide transformational and inclusive experience. I mentioned that, you know, in these underserved communities and populations, there are a lot of barriers for entry. And so one thing that we're trying to do is kind of you know, make that process, right, of getting in the career of your choice a little bit easier by providing that real world experience, adding an experience that you can add to your resume, and also gaining a professional reference at the end of the experience, while also making some money that, of course, you know, could be invested in the community in a bunch of different ways. We also like to provide coaching, training, and job readiness, skill growth, and employment. So that just kind of comes with being immersed in that experience, right? Getting feedback from a supervisor, having those weekly check-ins, and just kind of like knowing and learning new skills. And then one goal for us is, of course, to connect the youth that we support with more longer-term career options that are going to help them get to where they want to be. So that's going to be connecting them to college resources, maybe like mentors, counselors, and also, you know, hopefully at the end of their internship, maybe there's an opportunity for full-time employment there. So that's kind of some of the objectives that we have here. Perfect. So if you're interested in hosting or learning more, there's a QR code right there that talks a little bit more, or actually that QR code will take you to our interest form. I'll also go ahead and drop that here in the chat box. So yeah, my job as the job developer is to work with businesses and organizations, share more about the program, talk about the potential of collaboration and hosting an intern, and also getting you all set up and walking you through the application process. So that link that I put in the chat box is the QR code. That's the interest form. You can also learn more about our website if you go to seattle.gov/SYEP. And I'm also going to drop my email address as well, so you can reach out to me and get a hold of me that way. But yeah, so just, I guess, to summarize, quick SparkNotes version, workforce development program with the City of Seattle, looking for internships within healthcare, whether it's hands-on, whether it's behind the scenes. Yeah, some important dates. So the application is open right now. March 26th is the deadline. So if you are interested, got about a month left to submit your application. After that's completed, then we go through and interview the interns and create those placements. We use a matching process to match interns with the internships that are available. And then between May and June is when my team will do site visits. We just like to ensure that the site where the intern will be placed at is accommodating to them and their needs, and also, you know, is creating and fostering a healthy working environment. So that's one reason behind the site visits. And then June is when we'd onboard all supervisors. You'd get your meet and greets where you can meet your intern. We'd go over the timesheets and feedback process and all those things, just making sure that you're fully geared up and ready to support an intern. And then the internship period runs from July 8th to August 15th. One thing that's not included on these slides is the hours that interns can work. You're able to build out a schedule with the intern once that match is created. And interns are able to work 15 hours, 10 hours, 5 hours a week, all the way up to 30 hours per week. So it really just depends on the need and also your capacity as a supervisor to monitor and supervise and mentor the intern. Yeah, so I'll go ahead and open it up for any questions. And I think I see a hand up from Mr. Ollie Thomas. So yeah.
Sorry, I think I just missed this, but the pay scale for the interns, and I thought earlier you mentioned that it's a year-round program, but it's just during the summer. If a site wanted them to stay on during the year, what's the pay scale that you start during the summer that would have to be matched during the school year?
Yeah, absolutely. Yeah, great question. Thanks for asking that, Ollie. So yeah, right now we're focusing on the summer internship. The other programming that we have around the year is going to be it's called our Learn and Earn, and that one's a little bit different. That one's a stipend-based programming that is not as I don't want to use the word intense, right? But it's not as what's what I'm looking for. Like this program during the summer is kind of provides like a longer duration of internship time with supervisors. I guess that's kind of the best way that I can put it. The Learn and Earn one is kind of based around their school schedule. So it's a little bit more part-time, where this one could be closer to 30 hours, which is closer to full-time. But yeah, so the pay is $19.97 an hour for the interns during the summer.
Is there some precedent for their employment continuing during the year, even at a reduced schedule?
Yeah, so one goal for us is that hopefully like the interns can get placed full-time or maybe part-time after their internship is completed. But there's no like pressure whatsoever. There's no agreement or expectation that if you guys did decide to host an intern, that you would have to hire them on after. More than anything, we're just looking to kind of provide those opportunities where our interns can gain real world experience, because that's really what takes people further in their career, especially if, a lot of our interns are in college or decide to pursue college, right? We know that internships really are able to help you when it comes to graduating, right? And then getting in the career of your choice after having that real world experience. Yeah. Does that answer your question, Ali?
Thank you. Yeah.
Okay, awesome. Thanks for asking that. Any other questions?
All right. Well, thank you so much, Kamal, for coming in to share. We have one more program to highlight today, and I'd like to invite Frankie Rowe from Seattle Jobs Initiative to come off mute and share about the Introduction to Healthcare Employment and Apprenticeship Program. Frankie, take it away.
Awesome. Thank you. Good morning, everyone. I know I am the person between now and the cutoff, so I'm not going to take up too much more of your time, but did want to share a few highlights about the IHAP program. And can I share my screen, James? Awesome. So for many of you, you probably heard about the IHAP program and know a lot about it. If not, what I will share is that the IHAP program, Introduction to Healthcare Employment and Apprenticeship Program, is a partnership with the Healthcare Apprenticeship Consortium, the Training Fund, SEIU 1199, Northwest Multi-Employer Training and Education Fund, and Seattle Jobs Initiative. And we do have some other amazing partners as well that I will highlight in just a few minutes. So what is the IHAP program? Here are a few of the components of the IHAP program, and that is we have our digital literacy training where participants will come through the IHAP program and they will get a laptop and they will get 1 year of or up to a year of a hotspot or internet. And they don't have to give those things back. That is a gift for them so that they can continue to do other programs if they go on to step 2, or if they decide that they want to get a job and they work with our career navigators so that they can continue that work without having to rent out a laptop and things like that. And so we know that it's important for them to be able to have the tools necessary so that they can be successful. And then we have our digital literacy team that helps them with different things, getting set up, getting their internet and hotspot and everything together so that they can be prepared for the training. And what they will do from there is go on to step 1, which is the healthcare foundations. And this is where they will gain those skills, those soft skills, and our career navigators will begin to pull some of the skills to the forefront that they already have. This is a career exploration opportunity for them to see what are some of the career pathways that they can go into during those 3 weeks. And from there, our participants have an opportunity to decide if they want to go on to the nursing assistant certification, which is about 6 to 8 weeks. And if they decide to go on there, we have a bridge built between SJI and SEIU, where the participants go into that training where we're able to continue to support them and support the SEIU staff as well. There are additional opportunities that will be available to them if they so choose once they're working with one of our partnering hospitals, whether that's Providence Swedish, whether that's Kaiser, Multicare, and there's some few others on the list, but I definitely want to shout a couple of those folks out because I see them here on this meeting. And then from there, we're able to support them afterwards for about 3 to 12 months, depending on the route that they take. So if they go on to the MA program, medical assistant, or pharmacy technician, or sterile processing technician, between SEIU and the SJI, we're able to continue to support them. So IHAP at a glance, there was one thing that I wanted to call out because we haven't necessarily, I don't feel like we've called this out. And so I'll share a little bit more about that. But what I wanted to say is IHAP launched in July of 2020. And since then, we've been able to serve over 200 participants. It would be nice to serve 2,000 participants, and we're on our way there. But for now, we've served over 200 participants. Since 2022, we've been able to add 4 cohorts from Pierce County. So we're really excited about that work. SJI has also partnered with over 40 community-based organizations for support, and we have that bridge of support where they are able to refer their participants and things like that. So we are continuing to spread our web into the community. In 2002, we did a learning community with 10 community-based organizations, and I want to highlight that work because what it allowed us to do was to work with organizations who work with 18 to 25-year-olds who didn't know much about healthcare. So when we were asking them to refer, they didn't know a lot of that work. So we were able to partner with the city of Seattle. And I don't know if Stella's on here, but thank you for that work. And now what is happening is some of these community-based organizations are starting to refer back. And in 2024, this year, we will facilitate with Pierce County 6 cohorts. So that will give us the ability to serve up to 120 participants and get at least half of those, if not more, into healthcare careers. So a quick review of 2023, we had 3 cohorts in King County. We were able to serve 48 participants and convert 86% of those from phase 1 to phase 2, 95 completion rate in phase 2, and 50% were moved on to get an NAC credential, which that is amazing. Our Pierce County cohorts, we were able to serve 25 participants, 76 went on to phase 2, and 89 completion rate of phase 2. So this is really great work that we really appreciate. And 71% of them were able to get a nursing assistant certified credential. And last but not least, we definitely love highlighting our participants. And the reason why I chose Najma is because she found out about us through the YWCA. She went through the program, and though she didn't go on to work with one of our partnering hospitals, she went on to work at the Afghan Health Initiative. And what happened there, because she was so excited about the program and what we were able to do for her, she we, with the help of our career navigators, referred 14 people from the Afghan Health Initiative. And so that made our outreach less, but it also gave us the ability to be able to serve another community-based organization of folks who are coming in and who really want to work in the healthcare industry. And so with that, I will pass it back to you, James. If there's any questions, feel free to ask.
All right, fantastic. And for those of you up in Snohomish County, we do have our eyes up there. We're working on some funding to be able to come up and have this program up in Snohomish County as well. So for our closing words today, I'm going to turn it over to the fabulous Denise Banuelos. Denise, close us out today.
All right. I just want to say that this was a fantastic meeting. I heard a lot. We all heard a lot from all of our speakers that tells us that we need to get engaged. We need to improve our policies around prevention. We have an opportunity to get involved in a variety of ways for students to choose careers in healthcare. And so there's no excuse. We have options, and I really encourage everyone to get involved with what was been presented to us to the latter half of this meeting, and make sure that you are engaging your networks, engaging your employees, and your peers to find ways to tap into these opportunities. And I look forward to seeing you at Sound Career in Healthcare. And thank you very much for all the presenters and what you had to present. Learn something every time I hear from you. So thank you for that. And I wish everyone a great rest of your week, and hope to see you all soon.
All right, thanks, Denise. And we will see everybody. And we've already got a request to schedule our 2028 meeting on February 29th. So we will, that means that that HILT will be 10 years old at that point. So looking forward to that. So thanks, everybody. Have a wonderful day.
Thank you.
Thank you.